guys, what's up? My name's Gabby and today I wanted to talk about being a patient care technician, some of the duties that come along with doing this job, what to expect with how much you'll get paid, and kind of some insight on my experience as a tech. So our nursing school let us know that after your first semester, you could apply to work as a tech. The hospitals in our area allowed us to do that. If you're not sure if the hospitals in the area accept nursing students, go ahead and go up there or just call them up and they should let you know if that's something that they do. If not, I would highly suggest getting your certification as a tech. I learned so much, like time management, prioritization. I also just was able to become a lot more comfortable talking with patients and talking with staff like physicians and nurses and respiratory therapy, etc. So I think to get certified as a patient care tech, it's usually a few months process. So it's not something that's totally time consuming. I think it might take maybe 2 or 3 months, if even, but I'll have some more information on that below. If you're not in nursing school yet, I highly suggest you go ahead and just get your certification and start working as a tech, because it might give you some insight to see if maybe nursing is what you want to do, and it will help prepare you for nursing school, because your first semester of nursing school is basically kind of learning all those duties that techs do. So my experience as a tech was pretty good. I enjoyed it. At first it was pretty difficult for me just to get into kind of the routine of things. It was my first time ever working 12-hour shifts, so that was very hard for me at first. I just was not used to working those long hours. That's also something that will help you out in the long run. You'll kind of get into that routine that a nurse is in, you know. As a tech, it was awesome because I got the chance to work PRN, which is just as needed, and usually they're always needing techs to work, at least in the area that I was in. So in a way, I could kind of make my own schedule. So some duties you'll have as a patient care technician will be drawing blood, if that's something that your facility allows. It just depends. Taking blood sugars, doing vital signs 3 different times per shift depending on what unit you work on. Helping with ADLs such as, feeding and ambulating, changing a patient, like bed baths and things like that. It all just depends on the acuity of your patient, which means how capable they are of doing things on their own and kind of what level they are of functioning. I worked on a med-surg orthopedic unit and I liked it. Like I said, at first it was kind of hard getting into the groove of things, but I definitely learned so much. It was mostly like knee surgeries, hip surgeries, so there was a lot of like call bells going off all the time, which, that wasn't my favorite, but it was a very, very good experience for me. Now, a few months into working, I then started to get floated to other units. So I would get floated to the progressive care unit, the med-surg telemetry unit. I got floated to ICU a few times, and I even got floated to the ER once. So some things I struggled with working as a tech. First thing, mean patients. Now, I don't want to say mean because, you gotta remember these people are probably having like the worst days of their lives, and they're just sick, they're tired, you just don't feel good. So you gotta always remember that and keep that in mind. But there were definitely times where patients were just rude to me for no reason. It really, really shoots your confidence down, especially when you first start working, because it's like you're trying your best and you just want your patients to like you. And you know, there were times where I would go in the bathroom and I would cry, but as you keep working, I think you just kind of grow a thicker skin and you get used to this almost in a way, because it's always going to happen. As a tech it happens, as a nurse it happens, as any other healthcare professional it's going to happen to you. Like I said, you just have to remember, maybe they're just not having the best day, so don't take it too personally when a patient is rude to you. Now, as for that, you do still have to stand your ground. I think as a tech, it took me a while to be able to do that, because I think watching the nurses, a lot of times you see them as, oh, they're so self-assured, and it's like they know what they're doing. They're like boom, boom, boom. They're so good at what they do, and they're so good at talking to patients. But when you first start working, it's just not gonna be like that. I mean, for some people, yes, but I think for most people, you're gonna have to learn how to go into that patient's room and have it feel natural, because it definitely didn't feel natural to me at first. I had to really work on that. You gotta remember, you're an essential part of the healthcare team, so don't just think, oh, because I'm a tech, I can't speak up. You definitely have that right. And you also have the right to always advocate for your patient as well, so never forget that. Another thing I struggled with at first, this kind of goes along the lines of what I was saying before, but when nurses would call me on the little headset to go do tasks and I was already swamped, at first I would just say yes, and then I would have even more on my plate and I would get even more frustrated. And it was almost hard for me to just say no. If you are swamped and you can't do that task at that moment, that's okay. You just need to let them know, hey, I'm with a patient right now, I will call you back. Or if you are doing something with that patient that you know about how much time it's going to take, just let the nurse know, hey, I'm with the patient right now, I will go help you with that in about 10 minutes, is that okay? You know, sometimes I've had nurses, you know, get kind of, I guess, like pissy at me for that, but you just have to let it roll off your shoulders, and, you know, if anything, just talk to them, be like, hey, I'm sorry, you know, I want to help you, but I was with the patient, and what I was doing was important. Also, if you're in nursing school and you're working as a tech, and let's say you couldn't get hired on as a nurse extern at first, always ask about the opportunity, because as a nurse extern, you get paid more and you get way more experience. So as a tech, I started off getting paid about $12 an hour, which was good for me because I was just like living with my parents and I didn't have any responsibilities. Yeah, so about $12 is what usually techs start at. And as a nurse extern, I knew that the ones that worked at my hospital got paid about $14 an hour. So that was definitely a good little difference in coins. So if you're thinking about becoming a patient care technician, I would definitely recommend it. Like I said, I feel like I learned so many skills by working as a tech, and it just really improved my confidence in working with patients. So yes, I highly suggest getting some experience as a tech. I feel like it really will help you in the long run, and the nurses that I worked with that worked as techs beforehand also said the exact same thing. So if you like this video, go ahead and leave me a comment below, like, subscribe, and I'll talk to you guys next time. Bye.